what you were envisaging in terms of the scope, because of course we have a very small number of inpatient beds proposed. What is it you're saying in terms of number?
I obviously can't give what numbers I think, because I'm not an NHS manager, nor do I have the facts and figures. A broader brush. The current proposals are for around 150 beds, of which a smaller proportion of that are acute beds. I think there needs to be greater flexibility in the number that are available for acute medicine, if required. And I think that perhaps there should be some, and this all comes around to contingency planning and how they design the proposed new facility at Charing Cross. Some flexibility in how they design that building. So if it is necessary, both in 2020, 2025, 2050, whenever it may be, as was done with Chelsea and Westminster when they built their building, the flexibility is built into that structure. So we don't end up with a situation where we have with the current Charing Cross building, which was in difficulties from a maintenance and structural perspective, not many years after it was first built, and it was not very adaptable. So I think that is what I'm trying to say, is that there needs to be, from an architectural and a management and process design perspective, a flexibility in the Charing Cross site. I think it's important for us to also recognise that the NHS is proposing, I think, 150 to 200 million pound investment in the Charing Cross site as part of a £1 billion capital investment across North West London, and that is something that will significantly improve healthcare provision and healthcare services in this part of London.
I want to ask you about that. You say you welcome, obviously, the extra investment, and you said it will be more probably when all facilities are agreed. Does the fact that the full scope of what there is actually going to be at Charing Cross Hospital seems still to be something up in the air? Does that give rise to any concern?
I think when we talk about the NHS, we perhaps fall into the trap of thinking of it as the NHS, and it's not as simple as that. It is not one organisation. It is a very complicated group of different providers, over people who manage and run the NHS, such as NHS England, the Care Quality Commission, all these different organisations, the commissioners at CCG level, and also the commissioners at NHS England, the providers. So there's lots of different organisations, each with their own leadership and boards, and each with their own ideas for how they want to drive forward change. And that inevitably, and with any planning over 5, 10 years or more, creates uncertainty. However, I would like to see at Charing Cross as many services as possible to provide healthcare and even better healthcare for the residents of Hammersmith and Fulham that is clinically safe and supported by the expert clinicians at Imperial and beyond. Now, with regard to what I specifically said in my submission, or our submission, I think one of the question marks is over the elective surgery facility for North West London, or for part of North West London. And now I, from a parochial perspective, would like that to be in Charing Cross. I'd like it to be in this borough. And I believe that because of some of the services that we are being asked to give up, that there should be something that we get in return. But ultimately, the most important factor is the outcomes and mortality for patients across North West London and also this borough. And I think it's important that we recognise that the proposals estimate that they'll save up to 300 lives a year.
Just thinking, sorry to come back to the broader subject of money again, just thinking a little bit about what's going to happen on that site. Would it be better, given that we're not quite sure, would it be better to wait till we know exactly what facilities are going to be there before embarking on sale of land or demolition of buildings, or indeed any other irreversible step? Are we at that point yet where we can safely do it?
Well, I absolutely, there should be no demolition of buildings at Charing Cross, with the exception of perhaps some minor non-clinical buildings, before the final new building at Charing Cross is built. You know, the last thing we would want is a situation where they've started knocking down parts of the Charing Cross building and they're still building the new facility. You know, the new facility, and we've been told by the NHS that the new facility will be built and operational before any changes to the existing main clinical buildings at the Charing Cross site take place. And I think, again, I put it in my submission, but I think it's important to recognise that a significant amount of the Charing Cross site is not used by the NHS clinically. You know, a lot of it's used by Imperial College Faculty of Medicine, both for academia and also teaching medicine. A large portion of the site is ground story car parking. So there is room on the site for a new facility to be developed.
Should there be sell-off before we know the scope of what is going to be on the new site?
Okay, on specific points of South, and apologies for not answering that.
There's a two-part.
Yeah, of course. I think there has to be a great deal of further clarity before, you know, that will take place. However, I don't think it's any time soon that they would be proposing doing that. And I don't think there would be any development of any part of the site until after the clinical buildings are developed. So I think we're looking, and as these plans are for up to 2020 and beyond, I think we are many years away from that scenario taking place.
Well, I just want to ask you a little bit about something you raised at the outset of your presentation in relation to social care. You set out some of your concerns about the current situation. What is it that you say would be needed to ensure that the provisions, additional services are in place so that the emphasis can shift towards community care? What needs to happen first?
I think this all comes around the Better Care Fund, and I think the Better Care Fund, and this part of London, is one of the leading areas with regards to the amount of money and services that are part of the Better Care Fund. And it's incredibly important that the integration of health and social care is improved. And we all know that it's nowhere near as good as it should be. You know, anyone working in a healthcare setting will know that there are frustrations between the NHS and social care and vice versa when there's a patient who is clinically fit to be discharged but can't be discharged because the social care isn't ready. Or there's a patient who's been looking after by social care and the NHS isn't working in a joined up way to provide, you know, the services, the diagnostics, the treatment, the review, whatever it may be, in a streamlined fashion. So that patient ends up having to go back into acute care. So I think it's clear that integration of health and social care, we are towards the beginning of that journey, and there's so much more that can and should be done on that. So
the infrastructure now, it's not currently robust enough?
I think the infrastructure is improving. I think this area is a kind of a forerunner of improving that structure. And the NHS is investing a lot of money in the council's social care services to enable that out-of-care model, that virtual ward, to be in place. However, you know, I think it would be wrong, I don't think anyone would claim that that is fully in place and that needs to be in place before further changes to acute trusts can take place.
And just very briefly on that, what do you think would be the impact on residents if further changes were made to the acute structure before there's more development of the out-of-hospital services?
Well, I don't think that will happen, but if it did, then obviously it would have a worse outcomes for patients because there would be a gap in provision of care, whether in acute trusts or within the community. So I don't think it's possible for that change to happen without there being adequate and well-performing and assured care in the community working at a better level. And just to touch on just to add to, it's not just about social care. I think what we need to do a lot more of in this area, but I'm not signalling out this area, across the country, we need to be much better at preventative medicine, we need to be much better at public health, and not just communicable diseases and vaccinations, but preventing long-term chronic diseases such as diabetes, hypertension, all these different long-term diseases that have become much more prevalent in the last 20, 30 years than when the NHS was first developed. And that's why the NHS, both with that and an ageing population, is under the pressure that it currently is.